Hi everyone, my name is Janalea. I'm here to introduce the Marfan syndrome. What is Marfan syndrome? Marfan syndrome is a genetic disorder that affects the body's connective tissue. Connective tissue holds all the body's cells, organs, and tissues. Connective tissue is made up of proteins. The protein that plays a role in Marfan syndrome is called fibrillin 1. Marfan syndrome is caused by a defect or mutation in the gene that tells the body how to make fibrillin 1. This mutation results in an increase in a protein called transforming growth factor beta or TGF beta. The increase in TGF-beta causes problems in connective tissues throughout the body, which in turn creates the features and medical problems associated with Marfan syndrome and some related conditions. Because connective tissue is found throughout the body, Marfan syndrome can affect many different parts of the body. Marfan syndrome features may include tall and slender build, disproportionately long arms, legs, and fingers, a breastbone that protrudes outward or deep inwards, a high arched palate and crowded teeth, heart murmurs, extreme nearsightedness, an abnormally curved spine, flat feet. Risk factors. Marfan syndrome affects men and women equally and occurs among all races and ethnic groups. Because it's a genetic condition, the greatest risk factor for Marfan syndrome is having a parent with the disorder. Marfan syndrome can cause a wide variety of complications. These are the following complications. Aneurysm at aortic root. The pressure of blood leaving your heart can cause the wall of your aorta to bulge out, like a weak spot in a tire. In people who have Marfan syndrome, this is most likely to happen at the aortic root, where the artery leaves your heart. Aortic aneurysm and aortic dissection. An aortic aneurysm occurs when a weak spot in the wall of your aorta begins to bulge. This can occur anywhere in your aorta. Having an aneurysm increases the risk of a tear in the lining of the aorta, shown in the image on the right. Lens dislocation. Some people who have Marfan syndrome may experience the dislocation of the lens in their eye. Retinal detachment. Retinal detachment describes an emergency situation in which a thin layer of tissue, the retina, at the back of the eye pulls away from the layer of blood vessels that provides it with oxygen and nutrients. Retinal detachment is often accompanied by flashes and falters in your vision. Chest abnormalities. Marfan syndrome can interfere with the normal development of the ribs, which can cause the breastbone to either protrude or appear sunken into the chest. Scoliosis. Viewed from the side, the normal spine takes the form of an elongated S, the upper back bowing outward and the lower back curving slightly inward. Viewed from behind, though, the spine should appear as a straight line from the base of the neck to the tailbone. Scoliosis is a sideways curvature of the spine. Complications of pregnancy. Marfan syndrome can weaken the walls of the aorta, the main artery that leaves the heart. During pregnancy, a woman's heart is pumping more blood than usual, and this can put extra stress on a woman's aorta, which increases the risk of a deadly dissection or rupture. Marfan syndrome treatments. Heart tests. If your doctor suspects Marfan syndrome, one of the first tests he or she may recommend is an echocardiogram. This test uses sound waves to capture real-time images of your heart in motion. It checks the condition of your heart valves and the size of your aorta. Other heart imaging options include computerized tomography, CT scan, and magnetic resonance imaging or MIR. If you are diagnosed with Marfan syndrome, you will need to have regular imaging tests to monitor the size and condition of your aorta. Eye test. Eye exam that may be needed include slit lamp exam. The test checks for lens dislocation, cataracts, or detached retina. Your eyes will need to be completely dilated with drops for this exam. Eye pressure test. To check for glaucoma, your eye doctor may measure the pressure inside your eyeball by touching it with a special tool. Numbing eye drops are usually used before this test. Genetic testing. Genetic testing is often used to confirm the diagnosis of Marfan syndrome. If a Marfan mutation is found, family members can be tested to see if they are also affected. You may also want to talk to a genetic counselor before starting a family to see what your chances are of passing on Marfan syndrome to your future children. Thank you for watching. Hope you learned a lot from me. Goodbye.